This is Health Sciences Update. I'm Doug Nadvornick. We're in a time when the health professions in the U.S. have moved to a team-based caregiving model. Sometimes a doctor leads that team, sometimes not. The goal is to better coordinate care so that it's more efficient and effective both for the patient and for the provider. Teaching health sciences students how to work in teams is one of the focuses of the WSU Health Sciences program and the Spokane campus. Dr. Barbara Richardson is one of the leaders in that. She is the Director of Interprofessional Education here on campus, and we're glad to finally get you in front of the camera here.
Thank you.
So tell us a little bit about the evolution of interprofessional education here on campus.
Sure. The idea of interprofessional education actually is not new, but the component that is new is now that in order to be an accredited College of Nursing, Medicine, and Pharmacy, we have to provide opportunities for our students to really learn and work together. The reason being is when they graduate, they are going to need to work well as members of a healthcare team. And yet here on campus and on campuses actually around the world, students are educated very much in silos. So nursing students don't necessarily take any courses with pharmacy students or medical students, and yet we want them to be able to work together well as soon as they graduate. So interprofessional education provides those opportunities for students to learn together, to learn from each other and about each other, so that when they are in the workforce, they'll be strong healthcare team members.
So I want to take a step back then and talk about interprofessional work in the professional setting. Most of us see that from the patient's point of view, so we may not really pay a lot of attention to it. But how has that evolved over the years in terms of the way people work together in the healthcare setting?
Traditionally, in the United States anyway, we've had a very hierarchical model where physicians really were the team leaders. And in the past, physicians really had a depth of knowledge, I think, that most other health professions didn't. But there has truly been an explosion of healthcare-related knowledge. And we're really at a point where no one person can any longer know all of the most recent therapies, the best practices to manage the care, particularly for patients with chronic conditions, maybe such as diabetes or Parkinson's disease. And people with chronic conditions in particular really can benefit from having an entire team approach, so that a nutritionist, for example, or a physical therapist or occupational therapist, if they're all working together, the goal really is to provide better care with better health outcomes for patients.
What kind of transition has that been in the medical industry? Has it been a painful transition, or is it
slow?
Slow, okay.
It's been slow, and it really has to do a lot with how healthcare is paid for in this country. So it becomes a payer or an insurance driven model. And I think that we do hope that that will begin to transition so that health industry understands that a team-based model is more effective, more cost efficient, provides better health outcomes. And the other thing is really it helps prevent burnout for healthcare professionals. When you work in a strong team, there's a synergy there that you don't have when you're practicing by yourself. And so it will take sort of a gigantic shift, I guess, to really see it become popular everywhere in the United States. But there are particular places where team-based care really is catching hold for those very reasons.
So I alluded in the start to the fact that doctors are often seen as the leader of those teams, but teams I would think have to look different in different places, a big urban hospital versus a rural clinic. So who takes the leadership of those teams?
Well, that's why it's important for our students to learn and work together, because just with, for example, an orchestra that's a team, at times the violins are going to take a lead, at times the cellos will take a lead. In healthcare, it's the same thing. Sometimes it's the physician. We really need people who are strong at providing a diagnosis for patients and figuring out a plan of care. But sometimes when it comes to implementing that plan of care, a nurse might be the leader, really be a facilitator for the patient. Sometimes it has, a person also needs nutritional counseling, might need to work with an exercise physiologist, again with various therapies. And I think the other thing is in rural communities, people tend to know each other because oftentimes they're neighbors. They may worship together, their kids go to school together, so they know each other and they have a different type of relationship. And I think team-based care has caught hold in rural communities a little quicker than in urban communities where you may work in a hospital and have a different team every single day.
So now on this campus we have health sciences folks from several different programs. How do you start by teaching team care?
Well, I think that the basis is, first of all, teaching a deep respect for one another and the knowledge, the roles and responsibilities that each health profession can bring to that team. So we really work with our students to develop that respect. And then we try to progress. It takes a while for students to develop a sense of what does it mean to be a nurse, or what does it really mean to be a pharmacist? You don't have that the day you start. It's something that you learn over a period of time. So our goal is to really introduce students so that they get to know each other and they grow into those roles together over time. So we're hoping that through our interprofessional education opportunities that students will develop those relationships and understand when they're working together how, in fact, if their roles sometimes overlap, who should take responsibility, and usually it's context specific.
So in your time on campus, now about 6 years as we speak, tell us a little bit about some of the programs, some of the things you've used, the exercises that you've used to try to build that respect.
Sure. Gosh, the way that we've progressed up until this point really is to provide, we call it a menu approach. And we have, just like you would have on a menu, appetizers and a main course and maybe dessert, we have some activities that we call our exposure level. So it's just opportunities for students to be exposed to other students. That might be something like doing a job shadow experience. A popular event in the past has been sort of About You, About Us, where students would just be together and present information about their program. For example, what are the prerequisites to get into your program? They're different for every health science. What does the program look like? What's the length of the program? What kinds of clinical experiences will you have? What kind of research is going on in your area right now? What kind of jobs could you expect to get, when you leave? So that people just are like, wow, I didn't know that. So we actually do it sort of in a speed dating format, and the students really seem to like that. So it'll provide opportunities, for example, for a medical student and a nursing student to talk about their programs. Again, they haven't practiced yet, so they don't know a lot about what does it mean to be a nurse in the community or a physician in the community. So it's just, we have those exposure level activities. Another very popular one is called Death Over Dinner. Some people are like, really? I'm not so sure about that. But we provide dinner for students to create a more relaxed family-like atmosphere. And we have, say, maybe 4 or 5 students at a table and try very hard to make sure that that mix of students are students from various programs. And we use sort of a questionnaire. And the way we broach the subject is to just say, let's use this little questionnaire here and talk about what you would want for your own death if you could craft that. And there's no right or wrong answers. So students spend some time reflecting on, gosh, what would I want for my own death? And then they feel a little more comfortable talking with each other about that. And then we move on to talk about working as a team, caring for patients who may be at the end of their life. But it's been a very popular activity, and students say, gosh, I got a lot out of that. So we have exposure level, then we have what we call kind of immersion level experiences. And those are more simulation-based, I would say. So we've created a number of simulations here on campus. For some of those, we use mannequins, which are a high-tech plastic person. But they can do all kinds of things. They have heart rates, and they breathe, and they, through a computer, can have a voice. They don't move, but they can do just about anything that a human body can do. Or we use a program called Standardized Patients, which are trained actors and actresses. They aren't professionals. They're just like you or me or any of our audience who are interested in working with health professional students. And we train them to respond as if they had certain issues, healthcare issues. So we might train someone to respond like a new diabetic patient, for example. And that person would interact with the team. And so it's a great way to work with students, because once you're in that setting and you're focused on that person, boy, you forget almost immediately that they aren't your patient. So we have a great standardized patient program that we're growing, and I'm sure that we'll use that more and more.
Now, probably your highest profile, at least here on campus, is your Healthcare Team Challenge. Tell us a little about that.
Sure. The Healthcare Team Challenge is a model that was developed initially at the University of British Columbia in Vancouver. And I actually learned about it when I was visiting with some colleagues in Australia. And they were very excited. They were coming over to Vancouver to learn more about how to implement a Healthcare Team Challenge. So I contacted them, and they said, sure, we'd love to have you participate. So Healthcare Team Challenges are not unique to Spokane. They're actually held across Canada, very popular in Australia, Japan, and also now in Europe. So I think Spokane's one of the few places in the United States that's using a Healthcare Team Challenge. So what it involves is bringing together interprofessional teams of students, and our minimum number has been 3 teams. Some years we've had quite a few more teams than that. And in Spokane, we have always used a real person. Some of the Healthcare Team Challenges use a paper-based case, so just all the students get the history. But in Spokane, we've identified just wonderful, amazing community members who have been willing to share their story with our students. And we are so grateful for that. So, for example, we will have a patient who has maybe Parkinson's disease, and they come and they share their history with all of the students at one time. And we typically have a health provider, a nurse practitioner, or a physician assistant, or a physician interview that patient in front of the students. The poor patient's kind of in a fishbowl, I think. And then the students can ask the patient any questions they have. And then the students have a couple of weeks to work together. And we don't prescribe how that has to happen. It isn't a part of a class that they regularly see each other, but they use technology to connect. Oftentimes they get together here on campus. And what the students really are asked to do is come up with a collaborative plan of care. And for many students, it's the first time that they've said, oh, we really understand now how we each can contribute. So they begin to see that perhaps nursing and pharmacy might overlap when it comes to medications, that both nurses and pharmacists can do a medication review and talk about what medications are appropriate for that person's care. But given the setting, who should do that? But then they also see that, gosh, there's so much that I don't know about how nutrition might impact that person's life. That are they having trouble getting enough calories or the right kinds of foods? We all know that preventing falls are important, and all health professionals work on that, but who actually might be able to go into a home and do an assessment and say, gosh, you're at risk for falling. because you've got these area rugs or, things on the floor that you might accidentally trip over. You don't have any skid things on your stairs. So the students really begin to understand, oh, there are things that we all really care about, mostly the patient. So the patient's really the center of that team. But we each bring our own specialty to that team. And if we work together, the idea is that we'd have a lot better outcomes. And then the students come back together and share their plans in front of a team of judges, interprofessional team of judges. And we ask the patient to be there. And then we ask students to answer some questions. Things like, say, what did you do when you had a disagreement on your team? Or did a natural leader emerge? And what characteristics about that person caused them to step up and be the leader? So we ask them those kinds of questions as well. And then we always throw them a curveball. We give them some additional information and see how they respond, how they act quickly together in order to provide additional information to the patient's care plan. And then they present those additional ideas. But we've had such great luck with that, or great success. And I think, to me, the most beneficial things are when a patient then has an opportunity to speak and will say, I didn't know my care could look like this. I had no idea. My care right now is quite disjointed. I see a specialist here and a specialist there and this and that, but they don't talk to each other. And I didn't realize that I could ask for them to talk to each other.
So they can actually take from that experience themselves and help their care carry forward.
And in fact, one year we had a patient with a condition called dystonia, and she asked the student group to come and talk to the dystonia support group here and say, your care could look like this, but you're going to have to ask for it because right now some places aren't really providing a collaborative care model. So yeah, it's been beneficial both for the patients and our students.
So what are the challenges involved in interprofessional education?
Wow, the challenges are numerous. I think the biggest barrier for us really is that our students don't necessarily see great collaborative practice models in their clinical settings. All of our students take classes in the classroom, but they also have opportunities to learn in clinical settings. And they just aren't seeing that there. And those clinical settings aren't very well set up for teams of students to practice together. That's why we use simulation here on campus so that those students can learn and practice. The barrier of finding time is a big one. It's not one that we can't overcome, but it's difficult when students are in their classes all day, and it might be that the nursing students are off campus and clinical when the pharmacy students are actually on campus taking their classes. And so we do a lot of interprofessional education in the evenings, occasionally on weekends, when everybody can get together. So time is a big barrier.
So is it impossible to embed that in the students' curriculum?
Not impossible. In fact, we're working on it really intensively right now with the addition of the Washington State University's College of Medicine. I think it's a really good time for us to re-examine the model that we've been using and work towards truly embedding interprofessional education into existing courses. Some universities create a standalone course, and all students have to take a 1 or 2 credit interprofessional education course. But at this point, at least, we're really trying to embed it into existing courses. For example, all health professionals learn about quality and safety. It's just something that it's very high on our radar. We know that medical errors occur. We wish they didn't, but they do. And we also know that over 75% of those errors occur because of miscommunication. So if we can help students not learn about quality and safety in their own specific programs, but having them work together, it makes a lot of sense. So it's taking those topics where students already are learning about that and have them learn together instead of separately.
So what about the feedback that you get from students who have now graduated from WSU, Eastern, UW, gone through these programs, now gone into the workplace, and from those who take these events that you're talking about? What sorts of feedback has been the most valuable to you?
I would say that we haven't, it's hard for us to keep track, I guess, of our graduates. They really go all over the world.
Okay.
It's quite remarkable. But that said, I've had a number of students get back in touch with me. In fact, just last year, I had a student call and she said, I'm in a role now at Providence Healthcare here in Spokane. And she said, we have a patient, and she said, I just keep thinking about the healthcare team challenge, and this patient needs a wraparound service model, and we're just not meeting his needs. And she said, what should I do? And I said, well, do a healthcare team challenge. So I kind of talked her through the process, and it wasn't so a competition, but she called a team meeting and asked all of the people involved in his care to attend that meeting, and she said they all attended. She followed up and said it was quite remarkable. And the next time she went with this patient to visit his provider, all the notes were out and there was this collaborative plan of practice. And so she said it's making a difference. And it just warmed my heart to have a student say, you know, what that experience changed the way that I practice.
And do you see more of that in the future?
I hope so.
Maybe not quite to that extent, but?
Yes, I really hope so. And again, I think team-based care provides opportunities to improve the quality of care and make it more cost-effective, more efficient, and patients seem to like it better and providers seem to be happier. So it seems like a win-win situation. We just have to figure out how to do it and pay for it.
Dr. Richardson, thank you.
Thank you.
Thanks for coming. Dr. Barbara Richardson is the Director of Interprofessional Education here on the WSU Spokane campus. Health Sciences Update is a production of WSU Health Sciences TV. I'm Doug Nadvornick.